Davis Community Hospital. Where I work, I actually work with all kind of patients. The patients that stick around for a long time, patients that are still in critical condition but that don't stick around for very long as well. So I feel like I see a little bit of everything. Most of them are Caucasian, and then with the occasional Hispanic, and then the very few African American. A lot of them they're just born that way, but with those kids where there's not much, like I said, they're born that way or they're premature, they might be at our hospital for a long time because it's also a skilled nursing facility, just because of their complexity. And I think in those cases you kind of remember that family is just as part of the patient and just the patient, right? So complexity of their child, like when they're on a ventilator, family has to be willing to learn all that, and you kind of see in those cases parents aren't very involved. They don't want to be involved, and that could be socioeconomic status, or think of other cases, because there's medical and then there's trauma. You know, trauma season is coming, where I see a lot of patients who are in really bad motor vehicles, or cars landed on them, or things like that. And that does tend to have a theme, maybe, with 25 to 40-year-old Hispanics. Give you good examples of common things you might see, the one they always bring up in school is Japanese homes. Make sure you take off your shoes. Even if you're there for a call, you still take off your shoes out of just respect there. A lot of respect for that culture because of how family oriented they are. So I wish almost medical providers had a training on speaking Spanish, but the training in regards to working with the Hispanic community is trying to work with the family as well, because everybody's involved and everybody does want to help. Or whatever. But I had one patient one time where it was the same thing. It was a male transitioning to a female, and I still feel really bad. They were a male to me, and they were on a vent, so they weren't able to talk, and I'm there just getting a 12 lead, which is something that we use to look at your heart, basically. And the whole time I was calling them sir, just trying to be respectful. And then I get out and I look, and they had their name, and then in parentheses it was a female name, and that is to be who we addressed them as. And I felt so bad, but I was thankful for just that conversation I had with that nurse, and I was able to I went right back into that room and I apologized. And so everybody makes mistakes, and it's just you kind of make do and you try to learn from all those mistakes, and over time you're gonna have a lot of those experiences, and you learn very quickly, and you'll get comfortable with the medical field, which is a very hard field to work in regards to trying to make everybody happy.